Okay, so another subject that we're hoping to, or that we want to discuss today is embryo banking for poor responders. Does it work? The idea is that if you're a poor responder and you've only made 1 or 2 eggs a cycle, is there any benefit in banking a bunch of eggs through a number of cycles?
Okay, if I can take this, I think this is one of these absolutely ridiculous ideas that we face every few years, suddenly coming up from the literature. Why would anybody freeze embryos in a patient who produces only a small number of embryos, meaning fewer embryos than we can transfer fresh? And even going a step further, one has to address that also within the framework of most IVF clinics nowadays publishing, culturing every embryo to blastocyst stage, which is equally crazy in our opinion here at the CHR, because especially in older patients, many embryos arrest between day 3 and day 5. And so if you have fewer than you're willing to transfer, why not transfer them already on day 3?
I had a conversation with a patient just this afternoon before we came upstairs. She'd gone through several cycles in which they tried to culture out the blast. She never got any blasts.
Yeah.
If they got blasts, they did PGTA and they were all aneuploid.
Yeah.
We did a day 3 transfer on her, and 2 years ago, when I was speaking to her today with her little girl on her lap,
Yeah.
and talking about how we're going to try to bring in a sibling.
Yeah.
So it may be that embryos that make it to day 3 simply don't have the fortitude to survive in the lab, which is really a more hostile environment than a uterus would be.
Absolutely. I always say that to our patients, that we have a pretty damn good embryology lab, but it is never as good as a uterus.
That's right. And the thing that we don't know, maybe you can address this, David, is, are these problems that we're seeing in these women, in the embryos that make it to blast, or is that because they're growing in this environment?
It's a fair question. I mean, since this trend to extend culture has taken hold, it's become kind of the standard of care for so many clinics. The assumption's been, well, we can freeze anything and we'll get good yields back. But selecting for a blastocyst, which I think is one of the other questions that we're going to come up to, and the grading system we have, just making it to a blastocyst doesn't guarantee anything at the end of the day. So it kind of comes back to this: why is there so much emphasis on storage and cryopreservation? And we know this was at the convenience of how you set up your practice, okay? And the same with the concept of banking. Okay, when you think about it, okay?
Makes absolutely no sense.
It makes no sense. It's certainly, and I think this is a general theme that we have always held here, is to keep in mind the natural physiology of reproduction, okay? There's so much evidence now, too, that culture stress is permanent at an epigenetic level as well.
Absolutely, absolutely correct.
Yeah.
And that's what makes it so amazing that even the ASRM, in one of its policy statements, stated that embryo culture to blastocyst stage is standard treatment nowadays. I mean, it's mind-blowing to me. Especially since we now, over the last 2 years, have seen a few studies which have shown that cumulative pregnancy chances between day 3 and day 5 are similar, but trending towards a cumulative benefit for day 3 transfer.
Day 3, yes.
Yeah.
When my patients ask me about banking, I say, well, it probably would benefit us if we can take you through 5 cycles before we do a transfer. But what if the embryo that becomes your baby was produced in your first transfer,
Right.
in your first cycle?
Yeah.
You didn't have to go through those other 4.
Right.
Yeah. Yeah, and why culture to day 5 if you have fewer embryos on day 3 that you would be willing to transfer?
Right.
You know, I understand freezing some embryos if you have more embryos than you're willing to transfer and say, okay, let's
Right.
do culture the others to
To
bless.
take it to the extreme, if you have
Yeah.
one embryo,
Yeah.
there's no point in culturing to day 5. That's the embryo you've got. The whole point of this day 5 culture is for selection, if
Yeah.
you're going to do it at all. If you have
Yeah.
30 embryos, yeah, maybe you don't want to go through 30 transfers.
Right.
But
And we're talking about a population, you know, poor responders, et cetera. Yields are gonna be low to begin with. I
Of
think, you know,
course,
we have
of course.
to value the patient's needs in that situation.
Individualization.
Yeah,
The-
you're right.
The term that we have kind of forgotten about in IVF is individualization. Everybody does everything to everybody the same way, and that is not. That is okay if you have a low chance, I mean, a young, good prognosis patient. They will get pregnant nowadays, whatever you do to them. But if you have slightly older patients or patients who have some problems, you have to individualize. You cannot give them always the same treatment. You cannot treat a 25-year-old like you would treat a 43-year-old.